This is Radio Health Journal. I'm Nancy Benson. This week, would you know what to do if a loved one passed away?
It's not been something we've been brought up to address, and death is part of life, and we need to address it and know and understand how important it is to plan for it.
Coming up, preparing for the inevitable when Radio Health Journal continues.
A series of new studies confirm that African Americans are more likely to develop Alzheimer's disease and other dementias. Studies reported at the 2017 Alzheimer's Association International Conference show that stressful events throughout life worsen memory and thinking later on, and that African Americans are nearly 40% more likely than whites to experience those events. Dr. Keith Fargo is Director of Scientific Programs and Outreach at the Alzheimer's Association.
In a nation with our rich level of diversity, we need targeted interventions to address the racial and ethnic gaps that exist. This should include both risk reduction strategies and more family support services. We also need more research to help us understand how stigma may differ by community.
Another study reported at the conference shows that early life conditions, such as birth in an area with high infant mortality rates and living in a disadvantaged neighborhood, also increase the risk of dementia later in life. To learn more, visit alz.org.
Death is part of life. Its eventuality is something that people have been dealing with for all of human existence. Unfortunately, between wills, bills, finances, and now technology, your death has gotten more complicated for the loved ones you leave behind. Luckily, experts have created resources for you to organize your affairs before your inevitable demise. The only problem? We don't use those resources because many of us still don't know how to talk about death. Melanie Cullen is the author of Get It Together, a book which provides a roadmap for organizing your affairs. Cullen says she was motivated to write the book after dealing with her mother's death in the late 90s.
I found out instead that it was this big mess, like a bomb had exploded, wrapping up her estate, finding what I needed when I needed it, the information I needed when I needed it, was like a mystery tour. It just stunned me how difficult it was, and much of that was avoidable in terms of had my mother had her records organized in a fashion that was apparent to me as her executor and successor trustee, it would have just been such a blessing. It would have been a godsend. So I turned around and said, I will not do this to my survivors, and I put together a binder very much like what Get It Together helps a user prepare. And at that same time, I thought this is something that other people need to be doing and would enjoy doing if they just had the structure. So that was the birth of Get It Together, the book.
Like Cullen, Karen Lee Klein was also motivated to create similar resources amidst her own unexpected circumstances.
I was diagnosed with both two cancers, thyroid cancer and breast cancer. Had been a nurse formerly, and then when I was diagnosed with my own health concerns, first as a nurse, I saw many people struggling with what do I do now after losing a loved one. And then when I was going through my own challenge, I would turn to my husband and say, if I croak, what are we going to do? Or if I croak, do you know about what I want?
Cullen and her husband are the creators of If I Croak, The Things You Should Know, a comprehensive binder for getting your personal affairs in order. There are a lot of things to think about, but Cullen and Klein say that only around 50% of adults have even created wills. Both experts agree that getting organized is about much more than that.
There's a place for insurance, there's a place for your will, there's a place for all those important documents, but also things like passwords and identification, things like banking. So there's just so much to staying organized while you're living, but also when you pass on, you want that person who is going to take over, take charge, to know where to find your important information.
Cullen agrees the task of organizing can be overwhelming, but dying in today's digital age makes things more complicated than ever.
When they realize the enormity of the task, they become overwhelmed. Because it's one thing to collect up your related documents, like your will, your trust, the pink slip to your car, your birth certificate, your marriage decree, all this, the deed to your home. It's one thing to collect those documents. It's another thing to document all the information Because there's information in your head or around your home or around your office that also needs to be documented in a clear fashion. Doing all that is overwhelming for most everybody. A death 50 years ago was so much easier because of the lack of technology. Because if a bill came in the mail, I just walked out to your mailbox and I saw the bill and I found your checkbook and I paid your bill. Life was not nearly as complex as it is now. Now, while technology simplifies our lives, it really makes it more complex and mysterious and hidden for our loved ones.
To make the process easier, both Cullen's book and Klein's binder simplify this overwhelming process and take everything step by step. Cullen didn't have that when her mother died. She found herself inundated with advice that ultimately confused her more than helped.
When my mom was dying and then when she passed away, I had questions from well-intentioned but naive loved ones who were at midnight or 1 a.m. or the morning before the memorial were asking me questions and telling me things I should do that, in hindsight, were all out of sequence. So it was kind of creating a stressful situation for me because I was worried about things I didn't need to worry about that day. Get It Together helps to push out what you don't need to worry about today and bring to the fore, here's the information for what you do need to worry about in the short term.
So how do we get our loved ones to consider creating these binders? How do we talk about death? Klein has found that humor is a useful tool when discussing these issues, like the name of her binder, If I Croak.
When they hear the name, some of them laugh right away out loud. I think overall people know that the reason, or feel that the reason I named it that is so people can start talking about it and make it easier to have a dialogue between family members, loved ones. I think the reason, too, behind the name is I don't want anybody to think that it is a morbid topic, but this makes it lighthearted and fun. Death is something people don't want to talk about. It's not been something we've been brought up to address. And I think death is part of life, and we need to address it and know and understand how important it is to plan for it.
Cullen admits that approaching these issues can be daunting, but she says confronting death and leaving your loved one set can be liberating.
Yeah, there is a big stigma about talking about it, unfortunately. But then when you dive into it head first, and there are lots of good books out there about diving into the thoughts of your own death, diving into it head first, and the freedom that will accrue once you've done that. It's like peering into a dark cave and being afraid to go there and living with the fear of that. Instead, pick up the flashlight and let's check it out. Having gone through that, and I picked up a couple of flashlights, a headlamp, and I just dove head first into it to explore it, was so freeing. I realized it was like there was this boogeyman that if I just looked him straight in the face, I realized he's really not a boogeyman. He's just there. It's just a fact of life, and it just needs to be faced. So I think that once the fear is faced, we are all freed up.
You can find out more about If I Croak and Get It Together, along with all our guests, through links on our website, radiohealthjournal.net. Our production director is Sean Waldron. I'm Nancy Benson.
Radio Health Journal returns with medical notes in just a moment.
With the summer break gear tucked away for the season and new school backpacks at the ready, it's time to be thinking about serving up tasty, healthy meals and snacks for those on-the-go, activity-filled days of fall. Including foods that kids love to eat, like fresh grapes, makes it easier. Registered dietitian Courtney Romano is a health advisor for the California Table Grape Commission.
Stock your kitchen with foods that are easy to eat, that travel well and can serve multiple functions, such as hummus, whole grain crackers, cheese, fruits, and veggies. For example, heart-healthy grapes can be tossed into yogurt or a breakfast smoothie, packed into lunches or into sports bags for a fresh, hydrating snack. A bowl of grapes can serve as an easy side dish to a simple dinner of soup and sandwiches.
Grapes from California are a natural source of antioxidants and other polyphenols. With just 90 calories for a 3/4 cup serving, no fat or cholesterol, and virtually no sodium, fresh grapes are a smart choice. Visit grapesfromcalifornia.com for more information.
Medical notes this week. Students are heading back to campus, and after increasing for many years, binge drinking rates among college students are dropping. They're down 8% from 2005 to 2014. Unfortunately, those results haven't carried over to young adults who are not in college. The study in Journal of Studies on Alcohol and Drugs finds that binge drinking is up 4% for young people not in school. New research says in order to be healthy, you need to be both physically active and see yourself as physically active. A study in health psychology says a person's mindset can play a crucial role in determining their physical health. Researchers find that people who think they are less active are up to 71% more likely to die than those who believe they are active, even if their exercise levels are similar. And finally, polls estimate that 3 out of every 10 adults have at least one tattoo. That number jumps to nearly half among millennials, but a small study in the journal Medicine and Science in Sports and Exercise finds that those tattoos may make you sweat differently than uninked counterparts. Researchers say tattooed areas sweat less than half as much compared to unmarked skin, and sweat from those areas contains twice as much sodium. But researchers say unless you're covered head to toe with ink, the body should be able to regulate itself just fine. And that's Medical Notes this week. More in a moment.
Summer is almost over and our kids will soon be back in school. Let's make sure our youngest travelers get there safely. Hi, I'm Debbie Hersman, President of the National Safety Council, and this is your Safety Minute. As drivers, we need to be aware of everyone on the road, but especially children. National Safety Council data shows that most kids killed in and around buses are pedestrians who are hit by drivers illegally passing the bus. As the school year starts, remember, never pass a bus unloading children. When the bus has the stop arm extended, stay back far enough to allow for safe entry and exit. Obey posted school zone speed limits and watch for students walking and biking to school. A little care and caution can go a long way to help keep each other safe.
Safety Minute is brought to you by the National Safety Council and the Volkswagen Group of America.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.